My name is Neal Hamilton. I'm the Medical Director of Concept Cosmetic Medicine. Our area of specialty is in all areas of non-surgical cosmetic medicine. I'm a member of the Australian College of Cosmetic Surgeries and the Cosmetic Physician Society of Australia, and in our practice we try to provide a comprehensive service that ranges across the whole gamut of non-surgical procedures. At one end you can think of the beauticians, at the other end you can think of the plastic surgeons. We fit right in the middle. At one end we work with our filling agents and our botulinum toxins in ways that's very light. At the other end, with for instance our thread lifting and our resurfacing procedures, we keep you out of the surgeon's hands. But more than that, I guess the philosophy of what we do is most important. And that philosophy is that we don't want anyone to say, "What the hell have you had done?" We want your friends and family to be able to say, "Gee whiz, you look well." Now, my philosophy on lips is very clear. It should be a no trout zone. We think that lips should be full and they should be luscious and they should be kissable and all those nice things. We don't want lips that be coming around the corner. We just want them to be full and luscious and very kissable, nothing that's over the top. Our philosophy is to not treat lips in isolation, but rather to think that the lips are part of that whole area. So whether it be the folds that are on the side of the mouth, the sad cloud lines here, smokers' lines, whether people are smokers or not, all of those things need to be taken into consideration. Now, my particular approach to full face rejuvenation starts off with quite a simplistic concept, and that is that we think of it as just being like three balls that we juggle. There's the wrinkle ball, there's the skin quality ball, tone, texture, complexion, pigmentation and so forth, and then there's the contour ball. If we're dealing with the contour ball, the hyaluronic acid products is fantastic because essentially they allow us to revolumize a face and get what we call a three-dimensional volumetric facelift, the ability to lift skin and make more of a youthful, full type of look as opposed to being dehydrated and perhaps a little bit haggard. An analogy of that might be like a beach ball that's a little deflated, or like a balloon that's been left overnight. If we can blow those back up again, you actually do get a lifting effect that doesn't require surgery, which gives that sometimes, all too often, that terrible two-dimensional look. Different areas of the face require different answers. So for instance, if it is that we're going to plump up the apples of the cheek or the sweeps of the cheekbone, we might need a thicker material like that we can put it down deep in the tissues to create a nice soft contour. But if we're treating the tiny lines around the lip, or if it is that we're treating the hollows around the eyes, we need a very thin material because we're placing it superficially that doesn't leave any telltale marks that we've been there and no lumps. So whether it's the forehead, the old lady hollows, teardrops, whether it's cheeks, whether it's around lips or three-dimensional facelifting, we have a product that can fit all of those contingencies. We particularly love the hyaluronic acid products. Hyaluronic acid is something that we all have. Not only do we all have it, it doesn't matter whether you're a dog, cat or a tortoise. It's not species specific. And what that's nice, it's a very natural product to use. When we're younger, we have an enormous amount of hyaluronic acid. Witness the beautiful full cheeks of a child. When we're 90, we don't have so much of it. We have our skin not so elastic and full. If we can replace that hyaluronic acid, we can give people improvements in tone, texture, volume, give people a lifting effect that allows not only to look good at the moment, but most importantly, to create a collagen response within the skin that means that if we can give 10 units of improvement in the middle of 1 year, 12 to 18 months later, even if that product's worn off, we still might have 3 units of improvement left. It's a wonderful tool such as that the more you do it, the less you need to do it or the less you need to use.